Good morning, everyone, again. I hope everyone's doing well. I know here in Atlanta, it is storming like crazy, so I hope everyone's indoors and safe. My name is Angie Marchant, and I am one of the benefit leaders in the Palmer and Kay office located in Atlanta. And we are so excited that you're joining us today and want to welcome Vince Franchetti from MetLife. He's going to lead our webinar and talk through the MetLife Employee Benefits Survey. So we're excited that you're here, and I'd like to introduce Vince.
Hey, good morning, everyone. Really happy to be here. And just on behalf of everyone from MetLife, really hope you and your families are staying safe and well during these times. And also, too, we appreciate the partnership that we have with Palmer and Kay, and I'm really glad to be a part of the presentation this morning. So I'm going to go ahead and start the presentation. Give me one moment here. All right, excellent. All right, I hope you all can see my screen. So over the next 45 minutes or so, what I'd like to do is just walk everyone through this year's employee benefits trend study titled Supporting Employee Wellbeing in Uncertain Times. Over the next 45 minutes, like I said, the goal here is to walk you through the continued evolution of our trend study. We'll take a look at the new work-life reality that we're all living and operating in today. We'll touch upon embracing a model of well-being, and then lastly, we'll look at promoting well-being, employee well-being with benefits and communications, and then close out through a question and answer session. MetLife, we've been studying the employee benefits landscape now for 18 years, and I'm really confident in saying that there's no other group benefit insurance carrier that provides the amount of data and insights as we do. The COVID-19 pandemic has fundamentally changed our workplace, and really it's changing our work-life experiences. Employers like you all on the phone really need to take a comprehensive approach to managing the well-being of your employees. And really this is by providing a range of support across physical, mental, financial, and social elements. Benefits play a role in supporting employee well-being, and really it's looking at how they're interconnected to provide this 360 approach for the employee. So let's take a closer look at this year's study. Again, the title of this year's study is Navigating Together, Supporting Employee Wellbeing in Uncertain Times. For those of you that do follow MetLife's research, you will have noticed that we extended or delayed the launch of this year's study. We originally had planned to go out in early March with the 2019 research. We fielded wave one of research back in October of 2019. And right as we were getting ready to publish that research, well, we all started to experience what we're in right now, the pandemic. And so what we did was we went back out to the market and we reassessed and resurveyed and sampled of what we're calling wave two of our research. And that encompassed 2,500 full-time employees, as well as close to 2,600 employers across the country, which small, mid, and large employers. So when we go through today's presentation, you'll see that where I call out data as wave two or wave one. And for those of you that do visit our website, metlife.com/EBTS 2020, you'll also notice that the research is broken out as I mentioned here on the slide as well. So let's go ahead and get started. The new work-life reality that we're all living and breathing in today, this has really our worlds have been turned upside down. What was, this idea and concept of a blended work-life reality a few months ago has really taken a new shape and form, and it's really creating increased stressors on the workplace, and it's affecting the mindsets of your workforce, your employees. And that's what we'll look to uncover here today, but more so, we'll look at how benefits and programs can help mitigate those stressors of the workplace. We know that the lines between work and life have been blurred for some time, and really they were becoming increasingly complex for employees and employers. Data collected pre-COVID showed that 4 in 10 employees were struggling to balance the demands that came with this always-on work-life world. Interestingly, though, we had 60% of employers saying they too were struggling to meet the demands of this always-on work-life world. And if you think about it, before the pandemic started, we had some type of boundaries set in place. And what I mean by that is we were changing environments of where we worked and where we lived, right? We would wake up, we would go to the office, or go to the factory, but we were physically removing ourselves from our home setting and going to work, for those of you that don't work from home full time. That's completely changed, and that has had a huge impact in the mindset of the employees. With most of the country still, or I won't say most of the country, but there's a large portion of the country still requiring to shelter in place and work from home. And this, like I mentioned before, is having those increased stressors on the workplace. Think about it in the sense of, if your workforce, your employees are not working from home. They're home trying to work, and that's a completely different concept than that work from home mentality. You have employees that are trying to juggle all of those life's obstacles while trying to work and take care of a family. Think about the complete the childcare options. Were non-existent. Think about the ability to take care of an ailing or aging a parent. For those of you that are part of Generation X, what we call the sandwich generation, you're stuck in between there, and many of you are taking care of ailing and aging parents as well as raising your children. That has had a tremendous impact on one's mental state, but also too, for those that have those extra resources to help them along through this process, well, those were obsolete. You also have to remember, though, too, you have many of your employees and workforce that had to take on self-isolation. Think about, whether that was because they needed to quarantine, or they had a family or friend member who was sick and they were requiring to shelter in place. But this self-isolation also has had an impact on the workplace. Our research showed us that, our wave 2 of research showed us that 69% of employees had stated that COVID has impacted their daily routine. And while all of you on this phone look to maintain some form of business continuation, it's important that you recognize that you must be flexible while also meeting the demands of your business. In the current crisis, employees are even more stressed, right? So our research looked at what was causing the stress of the workforce. The number one stress coming out of our research is tied to personal finances, and we'll dive a little deeper into what that means. But when we started to look at those financially rated reasons, we looked at, 73% of the workforce, or our sample population, had stated that stock market volatility was an issue. Threats to long-term savings as well as threats to income. Think about the impact that the collapse of the financial markets had on your employees' 401k, just to highlight that. In addition to these, the financial implications of the pandemic, we also saw some health-related issues as well, or health concerns. We saw a large amount of employees extremely concerned about contracting the virus. They were also extremely concerned about their family member or friend contracting the virus. So that, again, has taken a toll on the workforce. And it's really important that we continue to support our employees during these times, because it will play out in the long run. When we dived into what were those demographics that were affected by the pandemic, we saw a disproportionate impact among women versus men. 72% of women had said they were more stressed because of the pandemic versus 61% of men. When we dive deeper into the sectors or the industries, we saw that the healthcare sector, which makes perfect sense, they were more stressed than non-healthcare employees, with nearly 75%, or 3 in 4 healthcare workers, stating that they were more stressed as a result of the pandemic versus non-healthcare workers. We also took a look at, looking at income levels as well. And I think this is such a big indicator when we start to talk about shared wallet. But for employees that were making less than $50,000 a year, well, we saw 70% of those were impacted or more stressed because of the pandemic. And then moving up to 100,000 with 62% of those employees being more stressed. And in the middle there, you'll see the 50 to 100,000. Other concerned sectors were, professional, scientific, and technical services. And then lastly, retail. When we start to dive a little bit deeper here, it's important to remember, though, that the food and beverage industry was a particular industry that took a massive hit as the result of the pandemic, with that industry losing 60% of its workforce, whether that was being furloughed or because of layoffs. So again, we're continuing to see this impact the workforce in a variety of ways. I will say, reading the news this morning, there was some promising or some positive information coming out of the latest jobs report. I believe we've declined down to, I think it's maybe a little bit more than 13% from 14.3. So in the May jobs report, so the market is beginning to make a comeback, but nowhere near those record numbers of unemployment that we saw back in the beginning of January. I think we were trending just below 4%. So something to keep in mind as we look at today's data. Your employees are feeling burnt out and stressed, right? And burnout and stress, these were, of course, two terms that had much weight on the workforce before the pandemic started. Our wave one pre-COVID research showed that the percentage of employees who are feeling burnt out and stressed, and how that impacted productivity and engagement and loyalty. And of course, those are probably three buzzwords that you're very familiar with, because I'm sure they make up the objectives of your benefit strategy. But what we saw, though, was that during wave one, employees who never felt burnt out or stressed, they saw an increase in, the trend of productivity, engagement, and loyalty was over 80%, 88, 84, and 89 there. And then as you move to the right-hand side of the screen here, you can see, where they're beginning to feel burnt out and stress half the time, and burnout and stress all the time. Burnout and stress, they are still very relevant today. They just take on they're wearing different hats. And it's important that we don't forget about this. The World Health Organization had identified burnout as an occupational phenomenon, and that's still the case today. And it's important that when we begin to look at employee well-being, that we take this into account. You're seeing today the burnout take on employees just working all the time, right? So what happened here? Sorry about that. You're seeing burnout take on where the employee is working nonstop, that barrier or boundary where maybe they were able to leave the physical environment. That hasn't happened yet. And so you're seeing employees work very late into the night and just go. And it's important as an employer that you recognize this and put in programs that help mitigate burnout and stress in the workplace. When we looked, in addition, as part of our wave two of research, we continued to see burnout and stress trending at the higher end of the spectrum here. We also saw tired employees are feeling tired at work, but it's also important to remember that discouraged, distracted, and depressed, those also too play a part into the productivity of your workforce. 22% of employees said that they were discouraged or feeling discouraged at work. 22% may not seem like a large number, right? But when you have 22 employees out of 100 employees who are discouraged, well, that's a pretty significant amount of your workforce. So it's really important that as we begin to look at those programs and resources, that we look at how they impact the workforce, whether that's how it makes your workforce feel or how it impacts productivity and output. So we know that 2 in 3 employees are more stressed today than before the pandemic, right? So on the last slide there, I had a statistic that showed 50 million U.S. workers are currently stressed. The combined effects of and the frightening uncertainty of our physical and financial health in the near future is putting pressure on the workforce. And you also can't forget about the self-isolation that are leading to that's leading to this stress. There's a poll out by Gallup that looked at the daily worry of America's workforce, and that has increased from 37% to 60% among the full-time working population. And daily stress has increased from 48% to 65%. Those are big jumps, and those are big numbers that we're trying to manage here. And as I mentioned before, personal finance tops the list of employee stressors, but there's also, as I mentioned, contracting the virus and social distancing that are impacting the workforce. MetLife's research, we looked to dive deeper into programs that may help ease stress, and coming out of the research, employees told us ways that employers can help them mitigate stress. Looked at flexible work hours and arrangements, Roth 401k and retirement plans, emergency hardship assistance, mental wellness programs, health savings accounts, and access to telehealth services. I'd like to spend just a few minutes on, going through a few of these here, but, think about flexible work hours and arrangements. I'm here in New York City. I live in Manhattan, and one of the programs that we're looking to implement here to help employers, and when I say we, the city of New York, are looking to implement or asking employers to implement is staggered work hours to help offset, employees on public transportation. And while that may be specific to the major metropolitan areas that have really advanced public transportation systems, it's something to think about when we begin to look at how the workforce is going to return to the workplace. Mental wellness programs is an area that's going to have a tremendous amount of opportunity for employers. We have seen the World Health Organization come out with a statistic that said 50% of adults will have some type of mental health disorder coming out of this pandemic. So it's important that we begin to think about how employers can look at ways to help their employees. And I go back to, I remember my background's in health insurance, and I remember back in 2000, I think it was 2008, we had the Wellstone-Dominici Parity Act, which a federal act that basically asked the fully insured accounts, health plans to cover mental health benefits at parity with physical health benefits. So again, you've seen in the past increased pressure or increased sight on mental wellness, and that's going to only continue to grow and only continue to be important. And let's not forget about ways that we provide funding to pay for all of this, right? Health savings account is probably more important than ever, especially as we look at the benefits of a health savings account. That is an account that is owned by the employee. The employer, of course, can contribute to that, but ultimately it's a great savings mechanism for the employee for that current year and beyond, and essentially they can use that money into retirement according to IRS tax regulation. And then lastly, it's that access to telehealth services, right? We've seen telemedicine for some time now, but you're beginning to see employers and carriers adopt teledentistry, and that will be it'll be interesting to see how that continues to evolve over time. But again, you're seeing employees state that these are areas that employers can support to begin to mitigate that stress that they're all experiencing today. So let's talk a little bit about how we can continue to support employees through embracing this model of well-being. Employee well-being is more important than ever, and it's how employers respond to employees today in the middle of this global health crisis that's going to affect the future state of the culture of your workforce. And what I mean by that is this, that how you all respond to employee well-being today, it's going to impact the loyalty of the workforce in the future. It's going to have implications on how employees interact and engage with each other. But ultimately, what it's going to come down to is the culture that you define for your organization going forward in a post-COVID world. We know that COVID has deeply affected everyone around us. And it's really important that employers during this crisis over communicate with empathy and compassion and really address employees' concerns heads on. And one way our research shows or highlights how to do this is, again, is embracing this model of holistic well-being. So what is a model of holistic well-being? Well, our research looked at 4 components, which are financial, mental, physical, and social. Financial health, this is the state of personal and family financial security. Mental health, this is the condition of psychological and emotional well-being, emotional intelligence 2.0, as someone told me before. Physical health, this is the level of illness, injury, and just your general lifestyle, your employee's general lifestyle. And then lastly here, this is social health, and this is the ability to form satisfying interpersonal relationships. And that is you're going to see play out quite largely over the next several months ahead of us as we embark on the challenge of engaging with each other in a social setting. Historically, I'd say employers probably have had maybe 1 or 2 of these and their definition of well-being, and you probably thought about them in a siloed perspective, but that's really not the right way to look at this. In order for you all to have a complete 360 view of your workforce, it's really important that you take this model of holistic well-being and layer them on top of each other and place the employee at the center of that. We've seen CEOs and business leaders that were part of the what's called the Business Roundtable here across the United States. It's an organization made up of some of the largest CEOs in our country. But what they did is they signed on to a letter that basically a memorandum that said, hey, we're going to put more focus on the employee. And that's really important because the employee is the backbone of any organization. There is a thought leader in this space. His name is Simon Sinek. You maybe heard of him before, but he really embraces this model of happy employees. And I'll go on to quote him, but he says, happy employees equal happy shareholders, or sorry, happy employees equal happy customers, and happy customers equal happy shareholders, right? And while not every one of us has shareholders, we all do have stakeholders at the end of the day. So again, just re-emphasizing that, it is important that we continue to place the employee at the center of what we do here. We do see through our research that employers that do adopt this holistic model of well-being, well, they're going to see a workforce who's more engaged. You're going to see an increase in productivity by 9%, and ultimately an increase in loyalty amongst the workforce. And those are 3. Again, I know those are 3 parts of your benefits objectives that you look to meet, and it's important for you all. So, another way to look at this though is how do each of these impact one another, right? If you think about financial well-being, that I'd say is the beginning, the baseline of the well-being model. If your workforce is not financially well, they're going to be stressed and anxious, right? We know those are parts of our conditions of mental health, right? If you're stressed and anxious, you're most likely probably going to have an increase in blood pressure, and that's going to affect physical well-being. And then we begin to look at how that's going to cascade into social well-being. So it's really important that from an employer's perspective that you embrace these 4 elements of well-being. We know that financial health is again the baseline piece of this. Before the pandemic, there was a report out by the U.S. Economic Households Well-Being. the U.S. Economic Report of Household Wellbeing. Basically, it went on to state that the adults today, I think it's about 40% of adults, 44% of adults cannot afford an expense costing $400. If they did have that expense, that they would have to borrow the money or sell something. $400 is not a lot of money when you think about it at the end of the day. And to have 44% of adults not being able to afford that should be that should cause concern amongst employers. Through our research, we saw that 52% of employees are concerned about their financial health in the wake of the global pandemic. Well, we tried to look at what was causing that concern amongst the workforce. And we looked at some of these short and long-term stressors. So again, looking at everyday cost of living, 44%, thinking about the groceries and utilities. I only predict that we're going to continue to see the cost of living increase, especially in some markets where population is quite dense and items may be hard to get to. And I'll specifically call out New York City here because that's where I live. But debt and getting into debt, your debt hasn't gone away. Whatever debt you had at the beginning of the pandemic, that's still there. Your name is still attached to it. And it's important that employers recognize that employees may even have gotten into even more debt because of the pandemic. Think about a family and possibly the spouse had lost their job, and this is just me putting scenarios out there. And then also too, it's lack of emergency fund. We saw 31% of employees tell us that their lack of emergency fund is causing stress, causing daily stress with them. And we know that we should have 3 months savings in the workplace. I don't know what's going on here. So great. So when we start to address aspects of employee health, 80% of employees agree that their employer has a responsibility for the health and well-being of the workforce. And this was up 8 points over numbers pre-pandemic. We did see, though, that only 15% of employers have a definition that includes all aspects of employee health. And it's in times of uncertainty. Again, experts agree that how the business responds will have this long-lasting impact on the future of your workforce. That's going to impact engagement, productivity, and loyalty amongst your workforce. I'd like to call out, one company making headlines for the treatment of their employees during this pandemic has been Ally Financial, and their access. There was an article in Fortune magazine that went on to talk about what they were doing for their employees during this time. They went on to highlight their access to free mental health professionals through phone, text, and embracing that employee assistance program. That's a great resource to be able to provide that level of support for your employees. They were also providing free financial planning support, which was access to certified financial planners and credit monitoring. 100% coverage of those virtual doctor visits. So think about that telemedicine and teledentistry that I had mentioned. They're providing paid caregiver leave and care for employees taking care of ill family members. And also too, they were launching well-being modules and challenges remotely that focused on staying physically and mentally healthy at home. I just think this was a great way, and that you saw an organization really stepping up and supporting their employees during this time. So let's move on to promoting. So when we look at this holistic model of well-being, some of you may be asking, okay, well, how do benefits fit into this here? I think it's really important that we remember that employee health and well-being is an everyday thing. It should not be something that we think about in that 2 to 4 week period before open enrollment begins. But it's something that we should be thinking about of how we can communicate the programs and benefits of our benefits programs year long, and consider employee well-being year round. So let's talk and dive a little bit further into this. We know that benefits play a vital role in helping mitigate employee concerns, and 74% of employees told us that while they're concerned, they are concerned about one aspect of their well-being and the result of the global pandemic. We know that 4 in 10 of those employees who responded said that their employer is currently not offering programs or benefits that help. And remember, though, too, we also have 15% of employers saying that they do not have a definition of a workplace that includes a healthy workplace that includes those 4 elements of well-being. So when we start to dive deeper of what benefits fall into these categories, what you see here on the screen is about 22 different benefit items and where they fall into that well-being spectrum. Of course, we're seeing, medical, prescription, dental, vision underneath physical, but we have a large amount of benefits that fall underneath financial and/or income protection. One of those benefits, or 2 of the benefits I'd like to call out here that again have tremendous amount of value to the employee during these times is EAPs and employee assistance programs. They provide that support. And we saw employers really increasing the amount of counselor visits. In addition, we also see legal insurance as a great resource for employees during this time, and that's on the middle right-hand side of your screen there, the last one underneath financial. But how does legal insurance help employees during this time? Well, think about, will prep, or think about estate planning. Those are 2 areas where legal insurance is a great tool or resource. But on the unfortunate side, that an employee does have to embark down any issues with their housing. Many of the legal plans cover mortgage legal assistance or landlord-tenant disputes as well. So other ways, again, this is a strong tool, a strong resource that an employer can offer to their workforce in these times. What you'll see here, though, is you'll notice that this slide is shaded blue and green, and through our research, what we've done is begun to highlight, those benefits that are must-have and must-have, nice-to-have benefits for your workforce. What you can also do as well is I encourage you to reach out to Palmer and Kay, but they can help you. But we have a tool on our website that looks at really being able to get a little bit more specific to the demographics of your workforce. So you can also trend this data by 6 different data elements to get a more unique and specific view of those benefits that are more specific to your workforce, or whether that's gender or generation or industry or region. You can look at that data and trend it appropriately. One program or one benefit that we saw play a tremendous amount of have a tremendous impact, or what I'll call is the champion program or benefit coming out of COVID, was disability insurance. And we know disability insurance is a strong and a piece of the puzzle for income protection. But we saw that those that were diagnosed with COVID that were unable to return to work or unable to work for a period of time and met the definition of disability, well, that we saw disability insurance coming in and supporting them in their time of need. When we looked at, this was covered during wave 1 of research, but those who did take a health-related leave in the past 3 years and had coverage through their employer, well, they were really set up to succeed, I'd say. They felt successful both in work and life. It's important that feeling is a big piece of mental health, right? They're also more likely to feel confident in their finances today. And again, think about where finances and how that impacts the well-being model, and then being more likely to feel financially healthy. On the right-hand side of the screen, I think these are givens, but they were less likely to live paycheck to paycheck. They were less likely to not have started saving for retirement, and then less likely to not have been unproductive because of financial concerns. And again, I call out the bottom right-hand one here, but you think about if you're not financially well, you're constantly thinking about what's driving that. And these are ways, again, this tool or this benefit here is really a strong a tool and as a resource to help begin to mitigate some of these items here. on the screen. I will say just really quickly here on the retirement piece, you can't forget that who makes up our workforce today, and looking at the cohorts, right? So we have the baby boomers. These are the folks that are either they're either in retirement or beginning to retire. Our research showed that many of them are delaying retirement because they don't have enough money saved. So again, think about this from a different angle there. Emerging benefits. This is a focus. This had been a focus from many employers pre-COVID as ways to attract and retain that top talent, and that hasn't gone away. You still have top talent that are part of your workforce, and it's important that we look at ways to continue to keep that top talent. And one of those ways to do that is through emerging benefits. We are seeing employees very interested in wellness and well-being programs that reward their healthy behavior. And we have to think of this as looking beyond smoking cessation programs, right? We have to really look at the true drivers and motivators of employees and their well-being, and how we can get them to partake in these programs, because we do know that well-being programs really do impact preventative care. Think about phased retirement. So again, you have baby boomers who are stating that they don't have enough saved to start retirement. So you're seeing that cohort interested in some type of phased retirement program. When we look at Generation X, again, the sandwich Generation X, this actually, through our research, we found that this was the least happiest generation. Partially though, because maybe because they're stuck in the middle here, but they also had responded that they were concerned that they would never be able to retire because of their financial situation. And then you also have millennials and Gen Z who are equally placing the amount of value on retirement, and while they're not there yet, there has been shown some interest in some type of phased retirement program. People are living and working longer, so it's really important that our benefit strategies keep up with that trend. We saw an interest in unlimited paid time off. I think that is while that seems great on the face, I think from an employer's perspective, I think employees forget that while yes, they have unlimited paid time off, they also don't have a PTO bank. And so what happens when they decide to leave the company? That's something that I've always thought about. But I do know that there are, from an employer's perspective, we also need to think about how we administer and manage an unlimited PTO bank, right? Next, we can't forget about family and caregiver leave. I think this is an emerging benefit that you're going to see employers really embrace in the future, and it has a tremendous amount of value. It has a potential to provide a tremendous amount of value for your workforce. And then lastly, professional development credits or some type of training programs. Think about many of you that maybe have went into a hiring freeze, and you're really doing everything you can to keep your workforce where it is. One of the tools we're seeing employers really embrace is that upskilling and reskilling of their workforce, and professional development is a great way to do that. And it allows your employee to maybe take on a different role in the unfortunate circumstance that their current role maybe is no longer needed. So these are areas I encourage all employers to continue to think about, and different ways to continue to engage your workforce through emerging benefits. When we look at how emerging benefits, again, can look at the overall well-being model and reduce stress, again, you're seeing many programs. And what I've listed on that screen is by no means all-encompassing. I encourage you to go out to the study. We do capture additional emerging benefits. But I think where we look at this research here, it's really important that we understand that these emerging benefits continue to provide that level of support for the employee in just the same way that our core or traditional benefits do. But again, you'll see here that those employers that do provide employees these types of benefits, employees are responding that the benefits do reduce their stress and improve their financial well-being. As well as make them more interested in working for that company. And I think you'll continue to see, as we get on the other side of this curve and on the other side of this unemployment, we'll continue to see employers place a tremendous amount of value here in this area. Employers who are providing these benefits, who are providing benefits during this crisis, you are positively impacting your workforce, right? So our wave two start of the pandemic research showed that, those employees that are providing programs that support the employee well-being in those 4 different areas, they're saying that your employee is saying that, yes, my employer does support me. Again, mental health, 78%, physical health, 74%, social health, 72 and 71. And then I encourage you all to spend some time and go back through that holistic model of well-being and just and chart it out. This is my benefit programs, and this is where they fall under this model of well-being, and it will really allow you to identify that white space or that opportunity to provide additional support for your workforce. As I had mentioned before, HSAs really are a great tool. I can't emphasize that enough, but a great resource that you're able to provide your employees. With medical premiums continuing to be on the rise, we are seeing the need for these types of funded savings accounts provide a tremendous amount of value. And whether that is, and I like to connect HSAs to this model of holistic well-being. But if we think about from a financial perspective, unlike other savings, under employer-sponsored savings accounts like HRAs or FSAs, the employee, the HSA program is the employees. It's theirs to keep, whether they choose to leave the company, but also too, their annual contribution, they're not required to spend like an HRA or an FSA. So at the end of that calendar year, that money is that employee's to keep, and that rolls over, and that continues to roll over year over year over year and grows in that interest-bearing account. And they can use that money to cover those mental health and physical health visits, eligible visits with their provider. In addition to, once they do hit the age of retirement, that interest-bearing account is theirs, and they can withdraw that money according to IRS tax regulation, and they can use that money in retirement, or they can use that money to cover, those eligible expenses. So again, we're seeing this as such a tremendous way for employers to really impact those 3 elements of well-being through a health savings account. And lastly, none of this is at all relevant or has no importance at all if you're not communicating it, right? So it's really important that as an employer, you communicate the benefits of the benefits year round. And we're going to continue to see a tremendous amount of need for this. I had an employer who was actually out in the Midwest. It was a hospital association, and they went on to talk about, whether, a healthcare organization. It was a physician office group, and they went on to talk about, whether it was the general practitioner who was seeing those patients each day, or it was the receptionist in the front. They communicated their benefits in the same extent, meaning that didn't matter the level of education you had, you received the same level of communication around your benefits. And I thought that was really important, because you're seeing that employers recognize that they need to communicate and simplify the message around benefits and when I was in health insurance, we used to write our benefit language at 10th grade reading level. We're now seeing employers and firms write their communications at a 4th grade reading level. So it's really important that we continue on with the value that communication has on benefits, and really communicate the benefits in the context of an employee's life, right? And make sure that they're able to relate to it. Ground those benefits communications in those short and long-term strategies. And then also too, start planning for open enrollment now. We shouldn't be planning for open enrollment when open enrollment is just around the corner there, but really think about ways that we can engage and communicate with the workforce year-round on benefits, because these benefits will continue to support our employees during these times. And we do know that 1 in 2 employees who understand their benefits are stating that they're holistically well. So again, I can't emphasize this enough. I only have 1 slide on it, but communication and open communication is a very strong piece of that puzzle here. And as we begin to get on the next part of this horizon that we're all now on, it will be really interesting to see the innovative ways that employers tackle this, knowing that many of us are no longer working in the workplace in an office setting each day now, and many of us are still working remotely. So, I'll close it out with this: one size does not fit all. So this just goes back to that earlier slide where I had those 22 benefits listed. But you can see here on the right-hand side of the screen, these are the different data filters that you can trend this data on to make it more unique or specific to your workplace and better understand what your employees are looking for. So with that, Angie, I'll hand it back to you, and maybe we can open it up for questions.
Yeah, thank you so much for going through that. Very, very informative, and I appreciated it very much, as I'm sure all the attendees did. We've opened it up for questions, and I do have a couple that have come in. So, Vince, the first one was asked, do I get a copy of these presentation slides, and what about the survey?
Yeah, so we are going to send you out the copy of the presentation survey. You can access the full study by visiting MetLife.com, EBTS 2020. And I believe, Angie, you're going to be sending them all a book as well. So you'll have a printed version too. All right.
That's great. One more here. Based off the research, where do you think the biggest opportunity lies for employers and their workforce as it relates to employee well-being?
I really say right now it's the focus should be on mental health. I think as we look across the country here, you're going to have a workforce that has had different experiences with COVID, and it's really going to be it's going to have an impact on the culture of the workplace. And what I mean by that is you'll have some employees who have had no touch point with COVID besides just the news, and then being asked to work from home. You'll have some employees who maybe have lost a family or a loved one because of COVID. And then you're going to have some employees who became sick, and then some employees who became very sick, right? And so that's going to have a variation on the mental health of the workplace. It's going to create some stigma in the workplace, I'd say. You're going to have some people that are just not going to want to engage with people in a face-to-face environment. And so I'd say, from an employer's perspective, mental health and the ability to provide empathy and compassion over the next few months is a big opportunity for employers to provide value to their employees.
Cool. And then the last one is, how will MetLife be addressing COVID and additional information regarding the pandemic?
Yeah, so we made a decision to say our wave two of research was not it. We're going to go back out and provide a pulse check on the market, and we're actually getting ready to launch that questionnaire or that survey now. And we're going to continue to do this for the rest of 2020. And so it's probably will be once a quarter where we'll go out. We are looking at doubling down though on mental health, and you'll see a future report out on the mental health of our workforce in the future as well.
Okay, great. That's it for the questions. Last call for questions. All right, with that in mind, we're gonna thank you so much for your participation. If you have follow-up questions, please call any of us at Palmer & Kay, your account manager, your account rep, or your sales executive here with Palmer & Kay. Thank you very much for attending. Thank you, Vince.
Hi, everyone. You're welcome.
Thanks.